Dr. Brandon Harshey here, and I was recently informed by my wife January that I have not done anything on ear infections here on the atlasoflife.com, and so today I'm going to do something about ear infections. We'll talk about ear infections, I should say. So let's start off by going to the ICPA website, and ICPA is the International Chiropractic Pediatric Association. You can see up there. And the website for that is ICPA4, the number 4, kids.org. When you get there, you go ahead and click on chiropractic research, and it'll take you to an alphabetical list of conditions. And you scroll down to ear infection, otitis media, and it'll take you to this screen. And you see various case studies and research studies on chiropractic and its results on ear infections. So I chose a few of the ones I like best, and we'll start out with this one. This is chronic ear infections, the side effects of the chiropractic adjustment. And it reads, this is a case history of T&P Roger, males, ages 6 and 9, from the records of Dr. Arno Bernier of Yardley, Pennsylvania. Medical diagnosis, chronic ear infections. Medication, multiple course of Secor antibiotic, nebulizer. Chiropractic result, both children have been free of medication and over-the-counter drugs for the past 3 years since the onset of care. Presenting vertebral subluxation. Tim, C2, C3, T12L1. Patrick, occiput C1, and sacrum. Now you notice that both of these kids had a vertebral subluxation in their upper cervical spine. First child had one with C2, and the other child had one that is occiput C1. For those of you who are not chiropractors, occiput is your skull. So, let you know what goes on when you have a subluxation up that high in the spine. Next up, we have chronic ear infections, strep throat, 50% right ear hearing loss, adenoiditis, and asthma. I actually like this one quite a bit, and you'll see why. 4.5-year-old female with chronic ear infections, strep throat, on and off for 4 years, 50% right ear hearing loss, adenoiditis, and asthma. Had been on antibiotics, Secor, developed pneumonia, on bronchodilators, and anti-inflammatory for asthma. Also given steroids. ENT diagnosed child with enlarged adenoids. Surgery to remove child's adenoids and to put tubes in her ears was scheduled. The chiropractic history was that she had subluxation at C2, T3, and her right sacroiliac joint. Again, you see the upper cervical subluxation playing a part at C2. Numerous enlarged lymph nodes and muscle spasm. Chiropractic care of 2 times a week for 6 weeks was scheduled, and after 3 or 4 adjustments, the mother noticed a changed child. She has life in her body again, acting like a little girl again for the first time in 4 years. After 6 weeks, pediatrician and ENT noticed no sign of ear infection or inflammation. Her adenoids, which were the worst the ENT has ever seen, were perfectly normal and healthy. Hearing tests revealed no hearing loss. Family told MDs all medication was stopped 6 weeks ago when chiropractic care started. Shocked and confused by this answer, the family was told to continue chiropractic care because it had obviously worked. There you go. I like that side effect of chiropractic care right there. And how about that child? How miserable was this kid with the chronic ear infections, strep throat, hearing loss, possibility of getting your adenoids removed, and asthma? That is a sick kid right there. Next up, we got the Atlas fixation syndrome in the baby and infant, recurring tonsillitis. Before I go on, I do want to say that I'm not a big fan of using the term fixation because there's a lot more going on here than just a fixation. For example, when you do have a subluxation, there are 4 components, and this usually occurs in the upper cervical spine. These components are the misalignment, which I guess could be construed as a fixation, I suppose. There's also the narrowing of the spinal canal, and because of this narrowing, there's going to be stress and tension on the spinal cord near that brainstem level. And then there's going to be an interference to the transmission of mental impulses from the brain to the body. So there's a lot more going on than fixation. But anyways, this reads, 18-month-old boy, recurring tonsillitis, frequent enteritis, therapy-resistant conjunctivitis, suffered from colds, rhinitis, ear infections, and sleep disturbances. I cannot imagine how bad that poor kid was feeling. Immediately after spinal adjustment, the child demanded to be put to bed and for the first time slept peacefully the next morning. Previously disturbed appetite normalized completely. Conjunctivitis cleared completely. Now, how happy were those parents? How happy was that kid? Able to go outside and play, and have a good time without feeling miserable. Again, upper cervical subluxation right there. Very important to get that upper cervical spine checked. The last one I chose because of the number of kids used in the study. The role of the chiropractic adjustment in the care and treatment of 332 children with otitis media. And it says this pilot study included children from 27 days old to 5 years old. It was on the effects of chiropractic adjustments on children with otitis media. Now, the number of adjustments on average administered to these kids was, they did it by types of otitis media. So we had acute otitis media, we had 127 children, 4 adjustments each on average. Chronic serous otitis media, 104 children, 5 adjustments average. Mixed type of bilateral otitis media, 10 children, 5.3 adjustments. No otitis was initially detected, 74 children, 5.88 adjustments. Now, let's move on to the conclusion, because that's really the most important part. The results indicate that there is a strong correlation between the chiropractic adjustment and the resolution of otitis media for the children in the study. Note, 311 of the 332 had a history of prior antibiotic use. 53.7% of the children had their first bout of otitis media between the ages of 6 months and 1 year. And a total of 69.9% of the subjects in the study had their first bout of otitis media under a year of age. This is consistent with the findings of others. You can see by this study how important it is to get your kids checked by a chiropractor early on. Kids get ear infections mostly in that first year of life. So getting them checked is imperative, really. And you know, I've talked to a number of parents that are kind of afraid and unsure about getting their kids checked by a chiropractor. They think there's going to be a whole lot of popping and cracking and yanking and cranking going on. And that's not the case. Kids they respond really well. You don't have to use hardly any force at all. The chiropractic adjustment on a child is very, very gentle. And when done very specifically, it can change their lives and the lives of the parents. It's amazing how a happy, healthy kid can make a parent's life and the parent's marriage a lot better. Now, I do want to address one thing though. Ear infections are not, chiropractic is not a treatment for ear infections. It is not a specific treatment for ear infections or any condition. Chiropractic's goal is to restore the proper communication between the brain and the body. And this comes by reducing that vertebral subluxation. That's really it. It's not a specific treatment for any type of condition. It's very important to get checked, get that nervous system clear, because when there is a vertebral subluxation, you have interference, you can have symptoms, you can have effects, like ear infections in kids. So I highly recommend that you take your kids to a chiropractor if you have not, especially when they're young. All my kids have been adjusted since birth. I have 5 kids. I was lucky enough to adjust my last 2 kids personally within their first hour of life, so that was pretty exciting. And my kids are extremely healthy, extremely happy, and we're grateful for that as parents. So, again, take your kids to the chiropractor, get them checked, get them adjusted if they need it, and you'd be surprised at how much better they will feel and how much better you will feel as their parent. And I can say that from experience. So, I'm glad you took the time to watch this video. I appreciate it, and we'll talk to you soon. Take care.